So far in our series of Livio Talks, we've delved into various health topics like Ayurveda, diabetes, joint pain, immunity, and much more. Today, in an ever changing world where health concerns seem to be growing more and more, we decided to shine a spotlight on a topic that's very significant for half of the population, which is in women's health, and that is PCOS. Now, many of you may have heard this word for the first time, or may have heard this before. You may know someone who's living with this condition every day, or it might be you that is living with this. Now, what is PCOS? PCOS is polycystic ovary syndrome. PCOD is polycystic ovary disease, and it's a common hormonal disorder affecting women, often during their reproductive years. And it's characterized by the overproduction of androgens, these are male hormones, and the development of small fluid filled sacs called cysts on the ovary. And according to the WHO, PCOS affects an estimated 8 to 13% of all reproductive aged women. And up to 70% of those affected women remain undiagnosed. So, PCOS can really disrupt the menstrual cycle, leading to irregular periods, and may even result in difficulties conceiving, making it an extremely important topic to recognize and address. So, without further ado, we gather here for this very informative talk, and I'm delighted to introduce our esteemed guest, Dr. Jyoti. Dr. Jyoti Lakhani is the founder and chief physician at Ayur Healing. This is an Ayurveda and Panchakarma clinic in Kolkata. She has more than 15 years of clinical practice and research experience in the field of Ayurveda. She holds a master in psychotherapy and counseling and also bachelor of Ayurveda medicine and surgery. She has expertise in treating both acute and chronic cases using only classic Ayurveda formulations, along with Panchakarma, meditation, and yoga. And today we're honored to have her for this live session. She brings with her an ocean of knowledge and will be sharing her invaluable insights on PCOS and how we can harness the power of Ayurveda to help. So, thank you, Dr. Jyoti, with your time here
Thank
and
you, Pritika.
audience.
How are you, Pritika?
I'm doing good, Dr. Jyoti. I hope you are doing good.
Yeah, well, I'm very good. You have given a very nice information regarding PCOS. I think this is the need of the time. Most of the girls I have seen it is starting from 12 years of the age now.
Okay, okay.
PCOS, if you have seen, now this is a main concern. We need to work on this together through this platform. I think I need to tell people how it is connected with their diet and the food they are taking, and why these days the periods are coming so early. And
Okay.
that is one of the reasons their organs are not getting developed timely, and that is the reason they are getting these kind of diseases, either difficulty in menstruation or getting periods delayed. Once it started, after that I'm talking about, and
Okay,
then
okay.
PCOS and different symptoms and emotional breakdown and plenty of things. So I think this is very important topic which need to be
Absolutely,
addressed.
Dr. Jyoti.
Yes.
So, jumping right into the question. So, what is PCOS and PCOD? Are they different? Are they same?
The PCOS is polycystic ovary syndrome. There's nothing, there is cyst formation in the ovaries, which are filled with water kind of substance. Okay? So this is actually not a that complicated disease, but it has become very common these days. But
Okay,
PCOD, when it is a disease, we call it as PCOD, and when it is a symptom, we call that as PCOS. These are
okay.
all same conditions, nothing much difference.
Understood. And so we understood that PCOS is polycystic ovary syndrome, or it's a group of symptoms. So, what is the major symptoms experienced for a person suffering with PCOS?
It differs from person to person. In few of the girls I've seen or the women I've seen, they're having no symptoms. Like
Okay.
accidentally, if they go for USG, they find out they have
Mhm.
cyst in ovaries, and then they try to treat it. In most of the girls I've seen, they have disturbed metabolic this what do you say metabolic disturbances in their body, At the same time, they are having disturbance in their menstrual cycle. Either it is delayed or it is early. Like,
Okay.
it differs from person to person again. They're having acne, facial hairs, loss of hairs, emotional breakdown, especially during and before the periods, and uh, weight gain among few, not everyone. I've seen especially the girls with slim body having PCOD problem. Very
Okay.
less menstrual blood. They're like very scanty periods, and plenty of other hormonal disturbances. The digestion even is very bad. The liver is involved. So there are
Okay.
multiple syndromes, multiple symptoms are there. It differs from person to person. I think which I have
Okay.
categorized is actually depending upon the prakriti of that person, their dosha
Okay.
stage, and their dhatu stage. So it differs from person to
Okay.
person. Like in Vat dosh people, it is little scanty. If it is
Okay.
like yeah, so pitta, if it is pitta dominant people, so they are having more. This is my observation. It may differ
Okay.
in situations, but this is what I have observed. In
Okay.
pittaja, like it is more, and like in kaphaja, it is not of much thing. So like it
Okay.
differs from person to person.
Okay. And for those of you who are curious about your own dosha, you can visit Livayur. There is a wonderful dosha tool out there, and you can find out what your doshas are. Now, speak coming back to these symptoms, right? Some people have no symptoms. Some people have symptoms like you mentioned, irregular periods, maybe weight gain, hair loss, or hair growth. What if these symptoms are left unchecked or they're ignored? Are there any major consequences?
Yes, yes. If you see these days, people are coming for infertility cases, especially.
Okay.
So these people are actually having problems with their periods, which were ignored. There are few
Okay.
people like who had this problem since she was, one girl was there. She was having this PCOS since her like 11 or 12 years of age. Nobody has diagnosed that, and they started giving her hormones at the age of 13 itself. She didn't
Okay.
understand that she was having PCOS. How at the age of 12 or 10 a girl knows ki what she's going through? So
Right.
like, it has great impact. It has great impact. And later what happens when you ignore it at that time, it like they have a problem with their fertility. It has the problem with the fertility issues, and then metabolic disturbances. Definitely they both are interconnected. The
Okay.
metabolic syndromes are interconnected. Then with their body style, they have this black colored neck. They have this yeah, they have this insulin resistance in them. They have this craving for food all the time. They're eating. Their fat metabolism is very bad. So there
Okay.
are plenty of things. The most concerning cause is their underdevelopment of their organs, which results in, or underdevelopment of their hormones, which
Okay.
results in infertility later, and then
Okay.
it comes in the limelight.
Okay. And from an Ayurvedic perspective, what could be the possible root cause for PCOS or PCOD?
For uh, uh, for PCOS, there are many reasons. I'll go for general causes. ठीक है?
Mhm.
क्योंकि in Ayurveda we have explained this very well, that we have explained it very well that uh, uh, Agni is the main reason. Agni, no, the digestive power. That is the
Correct.
main reason for for causing the disease or protecting from the disease. So when we talk about PCOS or any other disease, we always start from metabolism. Since I'm treating people every day in the clinic, so I'm just looking at their metabolic state first. That is my first concern usually. So their metabolic state is very important. So when we talk about the cause, so what they eat, how they live, how they uh, how they sleep, how they do their work, how lethargic these people are, or how they are tend to get these diseases. you know
Okay.
uh, they tend to have these because sitting in a one position for the longer time, no workout, eating late at night. It's called diva swapan. Sleeping in the daytime, getting late in the morning, getting up late
Okay.
in the morning, eating all the time heavy food. So
Okay.
like for the things which we and thinking then all the time talking about some mature things and the stressful environment, the competition in the society. There are plenty of factors. The commonly are these.
Hmm.
And one more reason which I want to mention, maybe it is not acceptable by everyone, but not being a girl, trying
Okay.
to trying to be somebody else, not being a girl, in
Okay. See, Dr. Jyoti is stuck, but from what I hear about the root causes, it feels like our entire lifestyle, the way we live, just these small, small things can contribute and cause such big problems in our lives. I mean,
yeah,
it comes back to that. But
yeah.
good to have you back, Dr. Jyoti.
So just being girl, don't try to be boy. You're not like in the competition of this world. Now we are trying to compete them. No need to compete. You're much far greater than those, anybody else in this world. Woman has the importance, utmost importance given in every religion, every society, everywhere. So we are competing with them in the name of clothes, like jitne short ho sake pehne. I'm not orthodox, I'm not against that. We have some important points in our body, which we call chakras. So when they are getting exposed, our energy, every woman has a special power in it. So whenever we expose ourselves much, na, that power is getting lost. So the thing is that, yeah, we are in the
Interesting.
world where we are competing with having smoke regularly. So that is the part where we have to work on.
Okay,
These are
okay.
the
So,
reasons which I am
lifestyle.
experiencing every day.
Okay, okay. I mean, you have patience, you know from experience what are these
Exactly.
causes, right?
That is why I mentioned this. That is why I mentioned all these things.
Absolutely. And what should be the Ayurvedic line of treatment for PCOS or
See,
PCOD?
whenever we talk about the line of treatment, it should be Nidan Parivarjan. Means first we have to correct the reasons from
Okay,
where it has started. Without stopping the reason, you cannot break down the disease. So always in Ayurveda, the line of treatment should be Nidan Parivarjan, and then it's
okay,
called Samprapti Samghatana. Means you have to break down the chain by which the disease is formed. So a
okay.
line of treatment would be, because if the main reason is metabolism or digestion,
Hmm.
so first we have to correct that. If your body is not detox, we have to detox the body. If your agni is not in its position, we have to get that energy, that agni into its position. And then if you are able to digest few medicines, then we start with that medical care. And then if a person needs some panchkarma therapies for detoxification of the body, so we go for some panchkarmas. Like in my case, virechan in Ayurveda is especially for pitta dosh, but in my experience I have done it on almost every PCOS patient, and it worked wonderful. I've seen
Okay,
results within 20 days, 15 days, and max a
okay,
month. I've seen tremendous changes in them. There was one
okay,
lady last like almost it's been a 1 year now. She didn't she was having PCOD, and she didn't conceived once in her 15 years of marriage. And after
okay.
doing one virechan, I'm not saying this is applicable for everyone, but after doing one virechan and just few changes in her diet and her workout, she conceived after 15 years, and now she's having a baby girl. It's a
Okay.
miracle, but it
Yes.
happens. It happens in Ayurveda.
I think one thing to remember here is not to self-diagnose and
Absolutely.
pretend like nothing is working. So do reach out for proper Ayurvedic help. And as you can see,
Because
Dr. Jyoti has so much experience with people experiencing true change with Ayurveda. So
And the
do pay
thing is,
attention.
every person has a different disease formation. So there is nothing universal law for everyone. We have to see the patient. According to the patient, we have to give the treatment. There is no particular one medicine will work for everyone. It might be different or it might be same.
Okay, okay. Coming to, of course, we all our bodies are different and all our conditions will be different. But for a person suffering with PCOS, is there any particular diet recommendations you would suggest to manage symptoms?
Yes. So So
Yes, Dr. Jyoti, can
yeah.
hear you now.
See, the diet has the utmost important role in usually my clinic. What I do, I make a combination of workout, diet, I mean your day schedule, matlab what you have to eat and what you don't have to eat, with, if it is required, panchkarma. If it is not required, I don't do. 99% it works with only diet and some few, very few medicines. Okay, so diet which I
Interesting.
recommend is which is not heavy to digest, which is according to your body, which suits to your body, which is very easy to digest, which doesn't contain much of the heavy proteins, which doesn't contain much of the oil. I mean, very simple vegetarian food, including your green moong dal, green vegetables, yellow moong dal, and very simple diet I recommend always. It has very important role, since if you have seen the PCOS condition, mostly it is coming to very youngster people and they are very prone to have this fast food. So one of the reasons for disturbance in their metabolism is having this fast food, which can be cooked very easily and very fast, and can be, and it takes utna hi time for digestion. It takes much time for digestion, in spite of their
Food
process of making is
preparation.
very fast. Yes. So the thing is, they need to work on that. Second thing is their sleeping time. I have already mentioned in the most of the things that night from 11 to 3 is the time for liver detoxification, and most of the youngsters are awake at that time, and that is reversing their metabolism, that is disturbing their metabolism.
Okay,
Third
that's
is
interesting.
going very fast in the life. They want to have this also, and this also. So for that, sitting in a place and getting rest for some time, like sleeping at least 8 hours. We should, what we should do, we should sleep at least 8 hours in a day, which is very important for our life, which is very important for balancing our doshas. And this is kind of a machine. Our body is kind of a machine which needs to be restored, its energy, which needs to get back to its original form every time it is working very hard. So running after things, stopping yourself, sleeping at time nicely, all these things are working wonder, with
Very
some
important.
time and workout empty stomach, which is very important. If
Okay.
you work out after food, it will not help. And most of the people having heart attacks because
Hmm.
they are having protein shake and going to gym. So one of the biggest reason for this also.
Okay. Interesting. Now, a big question here is: can Ayurveda cure PCOD or PCOS?
Yes, absolutely, absolutely. We have 100% successful rate in PCOS and PCOD, and it
Okay.
is only just mere changing your diet, mere giving you few medicines, very few medicine. In few people might have given more medicines, maybe liver is involved or other conditions are associated, and otherwise if no conditions are associated, only very few medicines are given, and they are absolutely fine. Just giving some workout, some yoga therapies, and meditation works very well in this. So this is a
Okay.
combination which I usually work on, and it gives me 100% result. I'm never disappointed in this.
Okay, that's good to hear. And what are some Ayurvedic insights into the emotional aspects linked with this condition?
Yes, since your body, the hormones in your reproductive system are being controlled by your main, head, your brain,
Correct.
your nervous system. So the stimulation always coming. So one of the therapy we give in Ayurveda is through nasal. It's called
Mhm.
nasyam. In PCOS and or in infertility, we give one therapy which is through nasal. How it works, how, what is the connection, since it is being the hormone level, and all other things are being controlled by the brain. So what we do, we stimulate the organ which is here and which controls
Okay.
the reproductive part, which we stimulate it through our nasal system or through some pranayam also. It helps a lot. So
Okay.
since it has connection with your the brain has connection with your hormones, and these hormones are responsible for happiness and emotional stage and sad stage, and going into your past and remembering the things which are not required at that time. So all these things are connected with your hormonal system. So when it is disturbed, you will
Okay.
definitely have all these symptoms. And once it is controlled, which we have seen in most of the patients in one or 15 days of the treatment, they tell me first thing has changed in me is I'm happy. I'm just
Okay.
trying to be happy. Which I was not. The first thing happens to me is I'm very happy and I'm very satisfied. So
Okay. Okay.
these are the other effects of Ayurveda. Ayurveda works on the whole thing. If you see the explanation, there is no direct explanation of this in Ayurveda, but whenever we
Okay.
see this kind of explanation is in Ayurveda with references, you will see that acharyas has worked on the emotional stage equally when we talk
Okay.
about physical health.
Okay, nice. That's very interesting. You mentioned there are therapies like yoga, meditation that really work along with this nasal therapy. Are there any other Ayurvedic therapies that a person can look out for
Yes,
treatment?
there are many therapies. We have Panchkarma, one of the topmost therapies, which works in the body in the very deeper level. I have seen the results with my experiences that it works in a very deep level. So Panchkarma
Okay.
is basically a detoxification therapy in establishing your metabolism at the same time. So the diet which we give during this time helps the patient to restore its natural capability of producing the worm or producing the sperm. So it works in
Okay.
that way. It works
Okay.
very well. And along with that, if it is required, then only we give this. Along with that, a proper workout in the form of, like,
Yoga.
rigorous workout. I tell them to go on the stairs and climb the stairs. I tell that we should always climb stairs because it includes every part of your body and it boosts your metabolism. Just your metabolism, since we have to keep this thing in mind that there is nothing wrong with your other system. We usually doctor work on the hormones. They
Hmm.
give hormonal therapies, and that they are further they further worsen the condition. Instead, we should treat the root. That root is their metabolism. By correcting that, we can correct this system very well. So this is these are the therapies we can use along with. I have seen meditation as tremendous effect, which I give personally. That is why I mention this in every talk. That personally, when I recommend a person for any therapy, meditation among it is going to be the top. And after that, some yoga pranayam particularly for this disease are mentioned, which they can which we can ask from your doctor, which you go. They will recommend which one is best for you and how it is going to work on you. When you go
Okay.
to a doctor, always ask about the details, how it is going to work on me, what had happened to my body, how we are going to
Hmm.
reverse, how this treatment is going to help them. So these are the things we should keep in our mind while going to a doctor.
Absolutely. It's not only important to get the treatment, but also for you to understand what it's doing to your body and how it's helping you. That definitely aligns your body and your mind. Now, another question that we have is, how does Ayurveda approach the management of insulin resistance in PCOS?
Very, very, very simple. Again, it is connected. Insulin resistance means what? There are increased sugar levels in your body. Your pancreas is not working well. I mean,
Correct.
it is only connection with the food you are taking. Absolutely, you're taking more carbohydrates. Your body, your lifestyle is like you're sitting in a position for sedentary lifestyle. Means you're lying down or you're sitting in a position for a longer time. So these are all the things which we need to correct. What happens with the body is when you're having a dirty kind of food which is not required by your body, which is more rich in carbohydrates and which is or a food which has more content of sugar in them. Sugar directly taking is not the only reason.
Hmm.
The food which releases sugar after the first stage of their digestion are also very important. We need to understand the diet concept. That is
Okay.
why Ayurveda works on scientific way of how this is correcting. So insulin
Okay.
resistance, the first thing you will see in first month of my treatment, I 90% see their color has changed. They have a very fair color now, like the previous one. The shade of their color has been increased. That indicates their internal detoxification. That indicates
Okay.
their metabolism is very good. So this insulin resistance has connection, and it automatically works when you follow this diet and this workout.
Okay, okay. And a big part of PCOS and suffering from it is infertility. So, are there any recommendations with managing fertility issues from Ayurveda?
Definitely, definitely. All these things work very well. Since I deal with infertility a lot, so I know how. everybody, every single girl who's coming to me, every single female patient is coming to me for infertility. They have been to plenty of doctors, they have done IVF, they have done that, but they are very much into this, and this treatment works very well in them. So
Okay.
infertility, it works wonder.
Okay, so infertility is definitely a major issue, and we will be touching up on this in depth in coming webinars, so stay tuned. Now, finally, are there any ebooks or any material from an Ayurvedic perspective on PCOD or PCOS available for us?
Yeah, it is available in Live website. You can go and check it there, and there are a lot of information given in our text, but that will be, you will find in some research papers, not openly. No, the books are there, but you go and check with your doctor. He will tell you actually the right thing, or you can keep one seminar for this in some community, so that doctor can guide people what is going on with them.
Okay,
And Live has a very good information regarding all the diseases, not just PCOS, but plenty of other, where you can go to the website and check out, and
absolutely.
you will get a lot of information regarding everything.
Cool. So we are on our last 4 minutes of our webinar. Dr. Jyoti, any final points you want us to remember regarding PCOD?
I would like to recommend one thing, that don't go for any like hormonal therapy for this. Find a very good Ayurvedic doctor around you. The thing has, like, yesterday only we were studying about one drug, and there I found a connection of, from a doctor. I came to know about the connection of how early menarche has connection with the
Okay.
infertility. Since the people are getting periods at the age of 10, 12, na, so the right age is 15. So we should always try to delay the menarche by consulting some Ayurvedic doctor as early as possible. There are possibilities with Ayurveda that you get your periods on time when your age will be there, and that is very important. That you should always, there are dietary recommendation for this particularly, that, like avoiding the ghee. Mostly we give plenty of oily things for the kids, so stop giving them the most, like, the things with most of the ghee. And
Refined oil.
instead there is yeah, there is a scientific diet which should be given to them. Instead there is a scientific workout which should be given to them, to get their organs developed on time, so that they don't suffer from PCOD in future,
Okay.
like after their period starts. So this needs to be addressed very firmly by the parents. Those who have young girls going to be in this stage, they need to work on that. If the girls is, and if you see any kind of these symptoms in them, just go to your Ayurvedic doctor, and he or she will recommend you the right way how you can stop that at this age, and let it come on the right age, and with the proper development of the organs. When organ is developed properly, you will not see these kind of things very commonly, which were not in the previous time. Have you seen anybody in the previous time having PCOD? No, because it was always after 15 they used to get their period. So the thing is, we need to work on that. I think with this note, I just, because we have very less time, so cannot explain much of the things. So next session will be on 12th, and let's see how we can see, how can I help you through that session.
Absolutely. Thank you so much, Dr. Jyoti. This was truly insightful, like every session is with you. So, thank you for your time. Thank you for sharing such detailed information. I understand we are low on time, but Dr. Jyoti is always available for a consultation through Livio. So, you can go through Livio and consult with Dr. Jyoti personally. I'm sure the audience has greatly benefited, and I'm sure you all have questions as well. We didn't get to go to the community questions, so stay tuned for that. And like I said, you can consult with Dr. Jyoti. The next session is on World Arthritis Day on the 12th of October. So keep that in mind. I would also like to thank the audience for being a part of this. Hope you enjoyed this session. With this, we'd like to end the session here. Unfortunately, we know how much you love this. But on the 12th, we will be back for you.
If anybody has a question now, please, you can send me that personally. I can answer them.
Yes,
Okay.
you can send
So
it to
we
Dr.
are
Jyoti.
shortage of time now, but if anybody has a question, they can send me in person. I can answer them.
You can also follow Levayor on social media for regular updates on Ayurveda and the Ayurvedic lifestyle, and you can ask us your questions there as well. So thank you for attending. Thank you again, Dr. Jyoti, for your time, and
Thank you
all
so
the best,
much. Thank you for
everyone.
inviting.
Good evening.
Thank you. Thank you,
Bye
everyone.
bye.